Hello, this is Dr. Stanley Lang, and welcome to this video presentation. Question for you is, do you believe that diabetics can actually reverse their condition without medication? And second of all, do you believe that they can do this and sustain it for a long period of time? So I'd like to explain to you a couple of different patient stories today. First of all, I want to review with you the model that I'm promoting in these videos, which is the whole person health approach that emphasizes integration of physical and spiritual and emotional health as the best way forward to address the many different chronic medical problems that people face, and particularly when chronic stress is part of the picture. So the first thing that I want to, or first story I want to talk about is a patient that has had some dramatic improvements in some of the numbers that I'm going to review with you. And in this case, this is a 3-month change, and we're starting with on the top, the fasting blood sugar starts with a 178, and the A1C is 8.5. Now the A1C is a marker that represents a 3-month average. This person didn't know that he was diabetic when I first saw him, so his need to control his blood sugar was really urgent because he needed some urgent surgery. 3 months later, his fasting blood sugar is down to 108, and his A1C is now less than 6, so 5.9. And the weight during this time has dropped more than 50 pounds. So the weights starting here to here. And the only thing that he did to lose weight was follow the eating plan that I have, because he couldn't exercise. The condition that he had didn't allow him to do any kind of physical exercise, and he needed to do some things about his diabetes if he wanted to get that issue fixed surgically. The surgeon was not going to operate without fixing these numbers. Now, in this case, he is using a very low dose of a diabetic drug called metformin. He's taking only 500 milligrams twice a day. Now, anybody that knows anything about these kind of numbers, you would expect this person to be on 2 or 3 medications to get this kind of a drop in 3 months. But he's managed to do most of the work with the dietary strategies, and then he's taking the metformin. Now, my guess is that he could probably wean off the metformin and these numbers would stay within normal limits at this point. But I know for sure that he will be able to do that within the next 2 to 3 months. So this is an example of excellent control of diabetes with using the lifestyle strategies and a very minimal amount of medication, and he's on his way to completely reversing the diabetes condition. The second person I want to tell you about has completely normalized her blood sugar. Her A1C was 5.2, which is even lower than this 5.9. And so she's completely reversed her diabetes simply by the lifestyle strategies that are part of the whole person health, the Relieve Stress Recover Health program that I have available. And so she's, just by following that, did not need any medication. And while she's following the program, she feels very good. So this isn't a time that you feel starved or that you feel deprived. Energy levels go up as blood sugars go down, as the body's chemistry corrects itself. You're not losing muscle, you're not wasting muscle away, you're actually getting stronger during this time. So I want to encourage you that if you or a loved one has diabetes or is pre-diabetic, that unless you're a type 1 diabetic that's dependent on insulin, the chances are very good that you can control and even reverse the diabetes by these significant dietary interventions. Now, like the first patient, you might need some medication for a while because of an urgent need In this case, the person needed to urgently get his surgery done. If he hadn't had that need, he wouldn't have needed to start this medicine in the first place because he was already dropping his blood sugar very quickly. And you can too, or your loved one can too, depending on what the circumstance is. So I want to hold out that hope that it's possible. And you don't have to starve yourself to do it. There are a lot of really simple strategies. I'm not saying easy strategies because changing habits is always hard, but it's simple strategies. It's easy to do, much easier, much more simple to understand than the American Diabetes Association eating plan, which I do not agree with because it offers too many high glycemic carbs, and it shoots yourself in the foot essentially if you're trying to reverse your diabetes. So I hope that you experience some encouragement about the possibility of completely reversing the bad chemistry by some simple dietary strategies. And if you're willing to make the sacrifice, you can turn things around. If you're not willing to make any sacrifices, then you get to sleep in the bed that you made. But otherwise, you can really change things around if you want to. So I wish you well in your efforts. God bless and have a good day.